I'm here in Orlando at the 2019 ASH meeting, and there have been a number of really exciting new options in the context of newly diagnosed myeloma. What I think we're seeing is really two big categories of trials. The first is trying to improve the depth of response with induction, and most of those really incorporate the use of daratumumab early on. So what we've seen in a number of different settings, for instance, is that an update from the CASSIOPEIA trial of DARA plus VTD versus VTD. There's an analysis of the PET scans at this meeting that demonstrates patients who get DARA are far more likely to have a negative PET scan than patients who don't. This is on top of the better response and overall response rate. The GRIFFIN trial, we're seeing that DARA plus RVD versus RVD is showing a deeper response and a better progression-free survival, favoring the group that received daratumumab. And then there are other smaller studies looking at daratumumab plus KRD, also showing very quick responses and MRD negativity at very early time points. We need longer follow-up to understand what that really means in terms of PFS, but certainly very encouraging data as well. When we begin to look at the non-transplant eligible patients, the real benefit here is beginning to tease out new treatments and options for frail patients. And there's very nice data from the European group using an ixazomib-based induction for truly frail myeloma patients, demonstrating good responses and very little drop-off from the side effect perspective, which I think is really exciting. So I think incorporation of new drugs, new targets, making it more effective for the younger fit patient, making it more tolerable for the older patient is really a bulk of what's here at this meeting this year.